my name is Katia De La Torre, and this is my presentation for Elements of Speech. Dr. Robinson, here are my 6 people for the audience. Okay, and my presentation is on the anti-cancer properties of marijuana. First, I would like to start out with talking about legal marijuana. In 23 states, it is legal for people to have marijuana as a prescription. Of course, here it shows a couple of the states where it's allowed, and there are specific rules and regulations that go along with that. In certain states, they have a fee in order to have the marijuana, and in other states, they also have like limitations on the amount of marijuana that they're allowed to have. Specifically here in North Carolina, which applies to us, it is not legal to have medicinal marijuana. Maybe one day we will change our mind about that, we'll see. So the reason that they prescribe marijuana is because it's great for cancer patients and even AIDS patients. It helps with their nausea, their vomiting, but best of all, it helps stimulate their appetite. And this is really important because the therapies that they're under really cause them to have a lack of appetite, and therefore when they don't eat, they really lose a lot of their muscle weight, and they're essentially decreasing their way of fighting the disease. But since it stimulates the appetite, it allows them to eat more and allows them to live longer. The problem with marijuana, though, is the dosing. It's really difficult to dose the amount of marijuana that they can use, and along with the other problems that everyone knows about marijuana. The side effects, the psychoactive problems that it has, the high feeling that you get, and the way that sometimes it can reduce your motor skills, and even cause hallucinations. So marijuana, the official name for the scientific term is Cannabis sativa, and there are different types of marijuana. There's cannabis and hemp, and the main difference is really the way that it's prepared. One is prepared for recreational purposes, and the other is medicinal purposes. The one with medicinal purposes has 5 to 10% more THC, which I will go into further detail in the next couple of slides. So there are 483 compounds in marijuana, and 85 of those are cannabinoids. Now, cannabinoids are compounds in our body that were recently found. It's a new system that takes effect in our neurons. And the way that this occurs is because we have endocannabinoids, which are very, very similar to the cannabinoids in the marijuana plant. So cannabinoids create a healthy environment in our cells. They really help with regenerating our immune cells, which really help fight our diseases. And not only that, they essentially just uptake the immune system by making sure that we fight disease correctly. In marijuana, there are, like I said, 85 different types of cannabinoids that have been found, but specifically, some that have been identified, the receptors have been identified, are THC, the compound that I mentioned earlier that's used, that's increased in medicinal marijuana, and cannabidiol and cannabidiol. And the receptors for THC are CB1 and CB2, and you can see around where they're located on the human body. So how the endocannabinoid system works. The endocannabinoid system was found through marijuana, essentially, because this is how they located it, and it was just a recent discovery. When they found it, they were amazed because of the way that it affected neurons. So this is a typical neuron. You have the presynaptic cleft and the postsynaptic cleft. And what happens is you have neurotransmitters that are essentially messages that are sent from the presynaptic cleft to the postsynaptic cleft. Scientists always thought that the neurotransmitters, the messages that are sent from one nerve to the next, only occur in one direction. But with the discovery of cannabinoids, it has been found that they occur in the opposite direction as well. These are messages that are sent from the postsynaptic cleft to the presynaptic cleft, and they help control the messages that are sent from the pre to the post. So how does this affect cancer? So it has been found to promote cell death specifically of cancer cells. It cuts off their blood supply, and it is extremely important because it does this without damaging the healthy cells. When you have chemotherapy, it damages all cells that are rapidly dividing, which is tumors and other cells after that. But with the use of marijuana as a therapy, it just affects the cancer cells, which is extremely important and could really be a useful therapy for treating cancer. What they've done recently is injected mice with tumors, and they've fed them marijuana, essentially. And they found that 25 to 30% of the mice were completely cured of the cancer. And the other 70 to 75% were found to have reduced tumors. It is important to note that it's only effective when digested, not when you smoke it, just because of the harmful effects that it can have on your body when you smoke it. So this is one of the examples of the research data that has been shown. Here you have liver cancer cells that were injected into the mice, and you have the tumor that was injected, and these were the tumors without being fed the marijuana to the mice. And this is the marijuana with the 15% THC, the cannabinoid, and you can see that the mice have reduced tumors on both different types of cancers. This is Hep G2, one type of cancer, and HUH7, another type of cancer. But you can see that it's effective on both of the cancers. Along with other with liver cancer and brain tumors, you have all other cancers that are effective or have shown effects against marijuana and have shown to have decreased tumors when the mice are fed with marijuana or different cannabinoids. So, in conclusion, you have the plant Cannabis sativa, which is the marijuana plant, and it has shown to have great effects on patients with cancer, specifically because of the endocannabinoid system and the cannabinoids that the marijuana contains. Has a lot of anti-cancer properties, but of course more research needs to be done in order for this to become very effective. We've always taught that drugs are really bad for us, but in this case, it might have a positive effect, and in the end, it might end up being legal in a lot of different states, not just the 23. Thank you.